Good morning, and I want to extend a great appreciation to our citizens in Sullivan County and the Tri-Cities area for attending this press conference this morning. I want to thank our media partners for being here. I want to extend a very gracious appreciation to our mayors of the Tri-Cities who are with us today, and we will allow them to introduce themselves in just a few minutes and deliver a very important message to our citizens in the Tri-Cities. We also have ballot representatives, Mr. Levine, with us, who will be given an opportunity to speak. And I really want to extend appreciation to our colleagues at Washington County Regional Health Department for attending here today. Obviously, this is a very important crisis that we're dealing with in the Tri-Cities, and we believe today is an important day to deliver a message of reinforcement to our strategies to prevent the spread of this disease. Without further ado, I will ask Mayor Venable of Sullivan County to come to the podium.
Thank you, Gary. Thank you, Gary Mays. Thank you for putting this together for us today. It is an extraordinary time in our county's history. This is the first event like this. Everyone in this room, media and guests, have been tested before we came in the room. We answered certain questions and we had our temperature taken. So we're all safe here today, and that's what we want our efforts to be. I am heartened by the cooperation that the public, especially here in Northeast Tennessee, has given in adhering to the directions that have been coming from our governor. I think at this point in time we have 19 special orders issued by the governor, the latest one last night, and our effort here today is to keep the public informed of where we are in this crisis, what's being done, and what we would advise them to do. And you'll hear some repetitive language today about washing hands and things of that nature, but they remain as important today as they were when this started. Again, we're very fortunate here in East Tennessee that we don't have the compact population of places like Nashville and Williamson County, and our efforts over this next few weeks will be to keep the public informed through events like this or press releases. I'll be, this afternoon, we're having a WebEx conference with our county commission at 4 o'clock. They will all be on the phone, and at that time, Dr. May and Gary Mays will update them on efforts. I know the same efforts are going on in our neighbors of Washington County and the other counties in the first legislative district. So I will stop there and introduce my good friend and colleague, Mayor Pat Shull from Kingsport. Pat?
Thank you, Mayor. For those that don't know me, I'm Colonel Pat Shull. I'm the mayor of Kingsport. And first, thank you to the media for covering this. You're doing a great service by helping us get out the word to the public of how we can slow the spread of this virus. Secondly, be aware that I'm surrounded with a bunch of great professionals in our Sullivan County Health Department, the ballot team, who are doing all they can to be prepared for the inevitable increase in the number of positive cases in our county. Right now we're at a very low level, but we don't think we're immune to this virus. And again, these great professionals have taken steps to prepare, and I have a lot of confidence in them. Similarly, I have confidence in what Kingsport and Johnson City and Bristol have done. The three mayors and their city managers, who are all absolute professionals, are working well together. Essential services will continue, be it fire, police, water, sanitation, and so forth. And my request is that citizens do what you can to help slow this spread. Observe the rules about social distancing and good hygiene and so forth. And together we can work through this. I'm pretty excited that we have the right people in place doing the right things to serve our public. Thank you.
At this time, we'll open up the Polycon for Mayor Fire Robin, City of Bristol.
Sorry, had to unmute. I'm here at my home. I'm trying to stay home as much as possible. Also, it helps time with working on other things as well. Great thanks to our health departments for the huge job you're doing, as well as Ballot and all our other healthcare officials out there, and our citizens. And thanks to comments for Mayor Venable and Mayor Schultz so far. This time is unreal for all of us. No one has experienced anything to this extent. We're finding our way, and though the path is far from clear, we are doing our best to figure out the best way forward. And to do that, we need everyone's help to continue. When we're anxious and fearful, remember Mr. Rogers' advice. Look for the helpers. You will always find people who are helping. We have many who are working hard, our healthcare workers, the nurses, doctors, caregivers, public safety workers, police, fire, utility workers maintaining our services, truck drivers, delivery drivers, grocery store workers, child care providers, food bank workers, and more folks who are doing everything they can. Some of us are serving in those roles. Some of us may volunteer to help. Overall, the majority of us can help the helpers by taking seriously the social distancing advice we've been given and by staying home as much as your needs allow you to do. There's popular on Facebook is the saying, act like you are already infected. And if we act that way, we can slow things down, slow the spread, stop the spread. Today, they're at the health department, social distancing with space between those who are present. And then we have two of us who are able to participate from our homes. Many of us are conducting business from our homes. We ask that you all do the same. Stay at home as much as you can. Limit your places of contact. Leave 6 feet between you and others if you go out. Wash your hands often. Unless you absolutely need to go out, stay at home. Do this to protect our helpers. Limiting the infection is the only way to get through this and return to normal life as soon as possible. Please stay safe at home, and thank you very much for allowing this time for us together.
Thank you, Mayor Fire Robin. And next is Mayor Brock from the City of Johnson City.
Good morning, all, and thank you so much for the invitation to participate in this press conference. As Mayor Schultz and Mayor Fire Robin have already talked about, we are in contact almost daily here in the Tri-Cities, or as we're becoming known as the Appalachian Highlands. My remarks this morning are directly to our citizens and to our businesses in our area. We are in unprecedented times. Just keeping up with the changes that are happening every day can be stressful. But the most important thing each of us can do is to be selfish about our own personal health. Make every decision in your day that provides you and your family the best protection to avoid the virus. Staying at home is best and provides that protection. I certainly have been doing that myself. But we know many citizens must work in healthcare, government, grocery, pharmacy, and other services that are considered essential. We also have some non-essential businesses that are still open and citizens are working. I challenge those businesses to be creative about how they get their products and services to customers in an effort to minimize public interaction. I am grateful to those businesses that have already done this. It is critical that all businesses put practices in place that protect employees and the public. You must ensure that social distancing is practiced by all those who are on your premises. Sanitation supplies are available when the public enters and when they exit, and employees' cleaning supplies and protective equipment are always available. Make sure your employee work practices are clear. Please write out your plan so your employees know exactly what to do. We all have a responsibility to stop the spread. I know the spirit of the people of East Tennessee will respond. This is what I keep in front of my mind all the time. What I do affects your health, and what you do affects mine. Let us all commit to stop the spread. The best way we can do that is to stay home. But if you have to go out, make sure you take maximum protection. I know together we can do this. Thank you very much.
Thank you, Mayor Brock. Next, we'll ask Alan Levine, CEO of Ballad Health Systems, to come to the podium.
Thank you, sir. First of all, I want to say that, you know, the most important thing we as a major health system need is steadiness and wisdom from our leaders. And mayors, I will tell you from the very beginning, as we began to see this threat coming back in January, we began engaging with our mayors and our elected leaders, and the steadiness and wisdom with which they've approached this is frankly something it's rare to see. And so we're very fortunate. I think we've all been very well served by the manner in which the mayors have engaged with the health system. I think hopefully they would say they feel that we've engaged with them to keep them informed. And together, that's how we're going to get through this. The health departments have been an important partner for Ballad Health. While we have mayors from the Tri-Cities here, it's important to recognize this virus does not know any boundaries. 40% of the patients that Ballad Health cares for are from Southwest Virginia, and we can't forget that. And so we're engaging there. Yesterday, we announced that we're standing up a hospital at Lonesome Pine to be able to help us so that we have a regional approach to serving people who need care when they need it. And we're grateful for the flexibility of the states as we've dealt with some of the special rules we have to deal with under our cooperative agreement in Virginia and COPA in Tennessee. Our message remains the same, and the mayors have underscored that now. We are at a tipping point where we're beginning to see, now that folks have come back from spring break, and people have traveled and come back, we've now started to see cases emerge. And initially, many of those cases, almost all those cases, were from people who had traveled and come back. And now we're at high risk of community-based spread. And that's why I think the mayors have decided to do what they did today and come together and really reinforce the message that we need to practice social distancing. We need to do all the things that our healthcare leaders are telling us we should do to help slow the spread. We have 170 plus ventilators at our disposal right now. We have 65 ICU beds available. We pray that those are not needed. But the slower this thing spreads, the better the likelihood is that we'll be able to care not only for people who might be diagnosed with COVID-19, but all those other people who have routine emergency conditions like heart attacks, strokes, and the things that everybody else is relying on us to care for. So I want to say thank you to the health departments. I want to say thank you to the mayors. And I want to underscore how fortunate we at Ballad Health, all 15,000 of our team members, feel about the steadiness and wisdom that our elected leaders have shown throughout this. And we are grateful for the support. Thank you.
Next, I want to ask Dr. Stephen May and Kristen Minnick from Washington County Health Department to join me at the podium. And I, again, want to say thank you to our Tri-Cities mayors, our county mayor, for leadership. But let's listen to the message. We do not have widespread COVID in the Tri-Cities yet, and we don't need that in the Tri-Cities. But we're watching to see what is happening in Nashville, Williamson County, certainly other parts of the United States, and it's very disconcerting. And they started out pretty much the way we look today in the Tri-Cities. And so we think the urgency of the message that the mayors have delivered is extremely important at this juncture. And the CEO of Ballad articulated very well. Eventually, it's about protecting our healthcare workers. It's about making sure our healthcare system can respond. And we cannot deliver a more important public health message than what we've delivered today as a Tri-Cities region. So we have the Director of Washington County Health Department with us, most everybody in Tri-Cities knows Dr. Stephen May, so I'm sure the mayors and all of us would take questions from our media partners. And again, thanks to you so much for delivering this message, and very grateful for your help. All right, questions?
How close are we to ordering some sort of county-wide or region-wide sort of stay-at-home order or shelter-in-place order that we're seeing at so many other cities around the U.S. right now?
That's a great question, and certainly the mayors in the Tri-Cities are working very closely with the state government and the governor of the state of Tennessee, and of course the mayors have that possibility, but I think public health position right now is where we should be. If the governor decides to ratchet up the closures, we of course would support that. But to do it unilaterally in a county or a city would not have the impact as much as it would from a statewide approach, I believe.
If I understood correctly, one reason that you've had this press conference is that we're at higher risk now because people are coming back from spring break.
Well, we think folks that have been traveling in light of spring break opportunities, and just all of our cases are related to travel so far. And so not just spring break, I wouldn't want to limit it to that population, but it's that population and others that travel to regions outside the Tri-Cities. If folks do that, and especially if anyone travels to a high-risk area, please isolate yourself for 14 days. If you become sick, consult your healthcare provider. It's a very simple message, but it's very important.
Have you had any advice or directive toward employers on how to handle employees who have traveled out of the area?
We certainly are, and I know Washington County and Sullivan County and other health departments in the region is a great question. Our business in the Tri-Cities very cooperative, and I commend them a great deal. They're instituting employee screenings. Many of our larger employers were very upfront and ahead of the curve in the way that they reacted and to mitigate the spread of the disease, and we commend them, and we encourage other businesses to do that as well. Protect them, protect the employees, and protect their customers.
So how far out of the area is out of the area?
Well, generally we are speaking in the 7-county, 8-county area is the area we're speaking of.
You address maybe some of the disparities between the state numbers and other reported cases that we're hearing. We heard of one at a business in Rogersville yesterday. Hawkins EMA, I believe, reported. There's also increased Tusculum students in Greene County who are reporting. Can you just address maybe why the state numbers aren't reflecting some of these cases that we're hearing yet?
Well, I think there are many things that we don't know, but the things that we don't know is the scope of the disease, because we still cannot adequately test the population. And so, but we do know that social distancing and the messaging that the mayors have delivered today do have an impact. And so I think it's much better for us to use the tools that we have, deliver this message consistently, and encourage people to comply. As testing becomes more prevalent in the state of Tennessee and more consistent, we'll learn more about the scope of the disease. But we do not have that data yet.
Why can't you adequately test everyone?
We simply do not have the capacity. We don't have the supplies, and we don't have the equipment to do that yet.
How many people have been tested in Sullivan County?
I don't have a total number of that's been tested. We do record and keep up with the number of negatives throughout the state, and looking at the statewide numbers we keep up with. And referring back to your question about why some of the numbers on the websites may vary, it takes us 24 to 48 hours to get these cases entered into the state databases.
Just one thing I would add, I agree with what Dr. Mays just said. The process, there's a lot of different organizations now doing testing. So Ballard's doing it, SOFA's doing it, HMG's doing it, Medical Care's doing it. Depending on where you are, there's different, ETSU has their testing. So what happens is if there's a positive, they then have to report it to the state, and the state then the next day at 3 p.m., typically there's a lag because it takes time for those positives to be, number one, depending on which lab is running the test, it might take days before the results come back. So the testing occurs, then you have to wait for the result. Then once the result comes back, you notify the health department, then they notify the state. So there's a lag in the reporting, and that's just built into the process until we get more real-time testing. And of course, we're waiting for the reagents. We should be able to do real-time testing at Ballad Health, hopefully this week. But we're obviously subject to getting the reagents from Cepheid, which is our manufacturer of the analyzers that make the lab equipment. But once we have that, we'll have the capacity to do 50 per day, and within about 2 weeks, hopefully about 400 per day. So there's no shortage in places to go to get testing. It really boils down to, it's a two-part process, being screened for the appropriateness, and then getting the test if you're determined to have the factors that the CDC recommends you should have before you have the test done.
Those factors haven't changed, have they?
We've had, as far as I know, we've had the same. The answer is, I believe they have not changed. If they do change, Ballad will be following whatever the CDC recommendations are for who gets tested.
So currently, you have to have been out of the area and have symptoms.
Or
Have
yeah, yeah. And I'm sorry, and there's a lot of physician judgment here too. If a physician for instance, on our Nurse Connect line, if a physician determines based on the totality of what he or she hears from the patient, they have the ability to say, well, you need to go get tested. And typically what we'll do is we'll try to rule out other respiratory conditions before we do the test. Because the test doesn't do you any good if you have the flu or if you have some other respiratory condition that we can treat. We want to get that out of the way first. So it's a process of ruling out. Just going and getting tested, there's a window of time where the test will result in a positive if you've been exposed. If you just run out and get tested and you're not in that window yet, you may have a false negative. So there's a right way to do this. So far, we have had over 9,000 calls just to the Ballad Health Hotline, and of the tests we've done, which is nearly 200, we've only had a handful of positives. So it seems like the process is working. And of course, the ones that we've tested positive, as far as I know, there's been only one that's been treated in the hospital. So I think it's working now, but to the point and why we're all here, we are at a tipping point where we can begin to see community spread. And this is the point where either we're going to be successful and contain it, or we're going to watch it accelerate. And we'd rather not see it accelerate.
What kind of time frame are you looking at here for continuing this?
I'm sorry, was that?
To anyone, what time frame are we looking at nationally now? I think the president has said he'd like everything open by Easter.
Well, I saw the press release last night at the national level, but our position at the local level is what we know and dealing with what we know. And what we know is social distancing and this closures, people washing their hands, folks doing the right thing if they're sick, stay at home, seek testing when it's appropriate, is the right measures. We do not want to look like other parts of the country. And we see, with limited information, we see what's happening to other regions. And the mayors and all of us in public health, we do not want that to happen here for our people. And so we're doing everything we can communicating this very urgent message. I know it sounds redundant, but it's a very important message. It's important enough that you have very busy people and our elected leaders together delivering this message. And I think the correct description used, we're at a tipping point. And I think it's very important if at the national level, if the rules change and the guidance changes, that's something we'll deal with at that time. But up until that time, we can still have an impact on the spread of this disease. I want to ask our Washington County colleague to speak to that as well.
Sure. Good morning. Something that I've asked my staff at the health department in Washington County, and I know our other county directors in the Northeast region have asked as well, is to think a little bit differently about how we do things right now. We're delivering services through the health department a little bit differently to protect both patients and our community members and our staff who are working, because they're vital to our operations right now. So what's vital to us as health professionals and public health workers is that people think a little bit differently about what they're doing in their normal day-to-day lives. Is it a little bit strange sometimes? Yes. Is it sometimes hard to think about not jumping in a car and going out and hanging out with your friends and seeing people? Yes, that's a little bit different right now, but these are different times. This is a virus that we don't know everything about yet. We don't exactly know how to treat it. We don't exactly know what long-term effects and those types of things are with it. So for right now, as we've come together as leaders in your community, please think a little bit differently and choose differently and choose a safer thing for you and your family to do right now.
Have you gotten any reports of gatherings happening despite, these messages you guys are sending out about encouraging people to stay?
So we are still continuing to hear reports of people who maybe are not following those social distancing recommendations. And for those groups of people, again, that's our ask, is to think a little bit differently and choose a different way of getting together and being with somebody. We have technology at our fingertips. We have ability to get in touch with each other where it's not necessarily face-to-face. So keeping those smaller groups, less than 10 people, together, if that's the way that we can do this and slow the spread, and that's what we're being asked to do, we encourage the community to be available to do that too.
Are you seeing it widespread with businesses around the Tri-Cities maybe not following social distancing or isolating recommendations? And what would be your advice to them?
So for Washington County businesses, which is what I can speak to today, I'm in contact almost daily with some of our larger employers in Washington County. And those leaders are seeking guidance from us and have instituted several response plans in their own businesses. So they're screening employees' temperatures, just like we all were screened before we came in here today. If somebody is found to be ill, they're making arrangements for that person to either work from home or just to go home and be well before they come back. So from my perspective, I feel like we're doing a really good job of being aware of that from a large business perspective, and I appreciate that from those partners.
Based on the spread of this illness, I've seen some health experts estimate that for every positive confirmed case of COVID-19, there's probably 5 to 10 unconfirmed positives. Would you agree with that?
I haven't seen any information about that. Dr. May, what do you think about that?
Well, we know the R0, which is the number of people we can infect based off one person. National studies are showing that it's around 3. So every one case that we find, we have the potential to infect 3 others, and with that you'll get logarithmic or exponential growth within the disease. So that further emphasizes decreasing the spread using these measures that are so critical. The other point we need to make is good sources of information, particularly for Tennessee. I would encourage you to go to tn.gov/health. That's where you'll find the daily numbers being posted, but also you ask about triage and assessment guidelines. They are standardized and can be found there and is the basis by which we're doing our testing today. There's also great information on when you should isolate and what's the difference between isolation and quarantine. So we do have a great local state website that we can use. We do have a lot of information also on our Sullivan County website, www.sullivanhealth.org. If you do call here the health department or in the Northeast Regional number, well, they have nurses that can answer your questions during the hours as listed.
Mayor Shaw.
Thank you, Gary. Mr. Osborne posed some really good questions relating to, 1, travel, and 2, the restrictions imposed by government. First, on the travel, the 3 biggest employers in Kingsport are Ballard, and Alan can speak for Ballard, and Eastman Chemical and the city. The city, we've been restricting travel for our employees for over 2 weeks now. In regards to Eastman, I'm very proud of Eastman. You know, Eastman has a worldwide presence, and they've practically cut off all travel of their employees out of the area. I see them as a very good corporate citizen, and I really appreciate what they're doing. About restrictions, you're right. The president did pose some very interesting question about, you know, the cure versus the problem. But the beautiful thing is that the three mayors and the mayors of Washington County and Sullivan County and the health department, we meet regularly, we talk regularly. We're trying to adjust the restrictions to be in compliance with the governor, and also what fits our particular area. And if we see need to change, we'll get together and we'll decide that together. But on another note, if citizens are concerned about how could I get some health care, or maybe I'm elderly and I can't make it to the grocery store, our United Way has been very helpful. And if you go to their website, they can provide all kinds of information in that regard. And our Chamber of Commerce has been very helpful. If you go to their website, they can help you figure out how to shop responsibly and help keep our local businesses employed as much as possible under these conditions. Finally, as an old soldier, I'd have to say the long pole in the tent is the preservation of our medical capability. We don't want to ever get to that situation where the number of infected patients outstrips the ability of Ballot and others to care for. And so that's why we're very mindful about the social distancing and the good hygiene and the other preventive practices.
Are we seeing any definite evidence of community spread anywhere in the region yet?
That's for one of the medical guys.
At this time, all of our cases have been tied to travel and returning back into the area, and thus our major goal is to keep people home, to keep them from going to areas where it is being community spread and bringing it back here.
Is it too early? Is it too early to tell if the executive order is issued by both Tennessee and Virginia governor? Do you think that, is it too early to tell if that has helped to curb the spread of the virus locally?
To answer your question, we don't know. It is too early, but we really believe it's a good strategy, and we do have a playbook to go by. An example would be the Spanish flu of 1918. Cities that did these measures had fewer deaths versus cities that chose not to do that. And so much of what we're doing was done then, and rightfully so. So is there anyone that has a final comment before we wrap up?
I do.
Okay.
One thing I want to just add, because it hasn't been said yet, but you alluded to it with your question, and I think we need to make sure, even as we're asking people to do all these things, I think there needs to be a real acknowledgement that there are a lot of business people who have companies and businesses that they've spent their whole life building and creating, and people who've been employed and rely on those jobs who are sitting at home now, and they're scared, they're frustrated, and I think that's those are the voices the president is trying to give voice to. When does this end? That is a very real and legitimate question. The fastest way for it to end is if we stop the spread of this thing, or at least slow it down. I don't know that we can stop it till we have a vaccine, but there's going to be a lot of other problems that spring up in the wake of this, as people have dealt with the loss of their savings, the loss of the consistency in their job. You know, when you're an employee who's been furloughed and you don't know when or if you're going to have your job back, there's very little in your life that's going to be as impactful as that, when you have to feed your kids, or you have kids to put through school, or you have family you have to take care of. So I think as we do this, we have to make sure we're very careful to acknowledge that there's a lot of people who are scared and frustrated right now, and we need to make sure that they understand that we understand that. I think that's why the mayors are trying to push to make sure we slow the spread down as much as possible and give our researchers and others time to develop a vaccine, develop treatments, so that this doesn't become something that continues to disrupt our economy. And I'm very concerned about the economic effect of not just on Ballad, but the whole region. I think we're all very interconnected, and we just need to be very mindful of the impact. And so it's a very good question, and I think we're all racing to get to that goal, whatever, as fast as we can, so that we can all get back to something of normalcy.
And I can tell you that my colleagues, those of us who perform services for the public, it's very important that the public knows that we're still there and that we're being innovative in how we're approaching providing these services. Today, we will announce a new policy as we meet with our county commissioners about how we deliver those services. Courthouses are still open, people are still there working, but in addition to the health effects, the economic effect on our people, and the fact that we're exchanging people into the office every day, even though the public may not be there, we have 10 people working in the office. They're going home and meeting with their families and their friends, and the possibility of them infecting an office, and our ability to provide that service is one of the things most important in our mind. That's why we're innovating today to try to bring a different way to do things, and you'll see that throughout this this episode. We're being attacked now by a virus, but as Alan said, the economic effect, people still have bills to pay. People have jobs. We know that some people will need help. Those of us in government are trying our best to continue the services that are essential. Our EMS people are working 24-hour shifts, our emergency people, our health department. So I just want the public to know that we're very aware of this. If the way to stop it is send everybody home, and we know pragmatically that's not possible. So we're trying to find that fine balance between serving the public and protecting the public at the same time. Thank you for coming here today. This helps us greatly.
Alan, real quick, before we leave, if you could amplify on what you were just talking about with the economic effect and what we've already been talking about here with the need for folks to follow the guidelines, social distancing, etc. As more and more economic effects become apparent, as more and more people are directly affected, if we are following these guidelines, logically, health-wise, we should still be staying fairly low compared to other places. And it's easier for us to say, this is a nothing burger around here. Why do I need to continue following this when it's costing me money?
I'm going to let Alan answer that, but it's because if it's a nothing burger, it's because we are following the guidelines. And we hope to have a nothing burger, using your terminology, Scott. But we're following the folks that will be displaced. Our Department of Labor and our American Job Centers are revamping their procedures where people can apply online. They're protecting their people that are working at the American Job Centers, but again, we're available, and we're going to extraordinary means, the Department of Labor and all of our state departments. Alan, you want to address that?
Scott, we watched an example of something yesterday that played out on national TV that was, I think, could be informative. Yesterday you saw a little bit of a tiff between the governor of New York and the president, where the governor said, we need ventilators. And the president said, well, you had the chance to buy 15,000 ventilators and you didn't. It's not good to see that kind of stuff play out, but the point is, you don't want to look back and say, why didn't we do what we should have done? You want to look back and say, people think that we overreacted because fewer people died. And so the steps that we take now, which seem painful, if we look back 3 months from now and say, we had very few cases and very few people died because of this, I would call that a success. It's hard for people to sometimes hear that right now because they're going through a different type of pain. And I got to tell you, I empathize. I empathize with a business leader who has to tell their loyal employees that they've been furloughed. I empathize with somebody who's worked loyally at a job, but because their employer has lost all their business, they've got to be furloughed. There's no winners here. There's nothing but losers in that. And if you look at even doctors' offices, you have doctors' offices now whose volume is 50% below where they usually are. How do doctors who've spent their whole careers building a practice and employing people who've been with them their whole practice, telling their nurses and staff they got to go home? And that's exceptionally difficult. And so, not to mention the impact on people's pensions and savings as they've watched what's gone on in the market. Ballad Health alone has seen $200 million evaporate of our cash because of what's happened out in the market. We're facing right now up to $50 million a month of negative cash because of 40% of our elective business that's gone. And so there's pressure for everybody in this. But that's the pressure I'm under and my staff is under is no different than the owner of a restaurant who can't serve anybody and had to send 2/3 of their workforce home. So there's no right or wrong answer here. The mayor said it perfectly. They've got the difficult job of balancing how do you sustain an economy with how do you protect your public. And I got to tell you, time will tell whether the decisions we've made collectively are the right decisions or not. But I can tell you, based on observing our mayors as they've gone through these conversations, they're asking the right questions, and they're concerned about people. Their concern about people is as genuine as I've ever seen in elected leaders. I could not, as the largest employer in the region, I could not ask for better leadership than we have in our counties here in Tennessee and in our cities and in Southwest Virginia. We have gotten nothing but support, questions about how we can help or how they can help us, how we can help them. And I wouldn't have it any other way. And listen, if things get bad, if we do end up with a spread and we do end up having to deal with capacity issues, things can get very difficult very fast. And none of us want to have to experience that. So I don't want us to be New York or Nashville or California, or frankly, no one's talking about New Orleans, which has the fastest growth in the world. But we don't want to become that. I think because of our population density, the mayor said that earlier, we're in a better place because we aren't living on top of each other. We're a much less dense population. So I think that we do have a better chance of slowing the spread. I do think, however, because of the health of our population and the age of our population, that if we do get a spread, people are going to be hit more severely with it. And so that's why reducing the spread is so terribly important.
Okay, and with that, we'll just end the conference here. I especially want to thank the mayors of the Tri-Cities for being with us this morning and delivering this message. I also want to extend a gracious welcome and thank you for coming, Kristen Minnick from Washington County Health Department. And of course, glad that we've had Dr. May and Mr. Levine, CEO of Ballad. So with that, we'll end the conference, and I'm sure the speakers will be able to do individual shots or takes with any one of you. Thank you.